and welcome to this episode of Health Options with me, Rabi, Abdallah. From the 27th of February, when Nigeria's imported index case was reported, to now that it has recorded thousands of confirmed cases, hundreds of deaths, and more than 1,000 recoveries, there has been a wide range of issues relative to the spread of the coronavirus pandemic and the country's containment efforts. As you are aware, the national response to COVID-19 is multi-sectoral, and it is on that note that this episode of the program shall be taking a look at some of those wide range of issues, particularly those that fall within the purview of the Federal Ministry of Health. You will get to meet my guest, the Minister of Health, Dr. Osagie Ehanire, in a moment.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
You are watching Health Options, and we have as our guest on this episode the Honorable Minister of Health, Dr. Osagie Ehanire, and it's all about COVID-19 and the national response. And it's also on that note, I welcome you, Honorable Minister, to Health Options.
Thank you, and thank you for inviting me.
Okay. COVID-19, like I mentioned in my introduction, from the end of, to be specific, 27th of February, when our index case was announced, a lot had happened. And here we are today dealing with containment, trying to checkmate the spread of the virus, which is already in a community transmission stage. It is on that note, sir, that I want you to quickly tell Nigerians what today you could say remain our biggest challenge when it has to do with the containment of COVID-19 in this country.
Well, the biggest challenge is still the surveillance and epidemiology, tracing and tracking all those who have tested or who are positive and testing them, and being able to isolate them until they are test negative. That is the biggest challenge in itself.
Why? Why is it so much of a challenge?
Because we are in the era of community transmission. When we had the first cases that came in individually, you could discover who their contacts were and then test the contacts and put the contacts in isolation, even if it were self-isolation in their homes. Now we have moved to a phase we call community transmission, where the people who are testing positive have never been abroad. They probably do not know if they ever had contact with anyone who went abroad. So it is now almost like an indigenous problem. It is no longer what it was at the beginning, like an imported problem. Okay. So once you have that community transmission phase, it becomes difficult. It is no longer a class situation of those who came from abroad and their friends. Now it is everywhere. It is in the communities, in the low-income areas, in the high-income areas, and very widespread. So tracking and tracing those who are positive becomes a problem. What complicates it even more is the fact that a good number, estimates give us up to 80%, 70 to 80% of persons who are positive for COVID-19 do not have symptoms or have very mild symptoms, but they are infectious, which means they can transmit the virus to other people. And those people they transmit the virus to can suffer or lose their lives.
Okay, does that explain why the asymptomatic patients, it's such, I don't know, there's been trending issues around it such that a lot of people are even still in denial, such that even when they get tested, get tested positive for COVID-19, they still insist that they don't have because they are not presenting symptoms.
And that's exactly the problem, in that a good number, particularly the young and able-bodied, and even children who test positive, who have contracted the coronavirus, have strong enough immune systems to actually tackle the virus, it seems, and also do not have any symptoms. But they do shed the virus. Shed means that they release the virus when they cough, when they sneeze, even when they breathe. And according to latest knowledge, even when they speak. So a person who is completely without symptoms or with very mild symptoms that you can neglect or ignore, maybe just like feeling tired, is shedding the virus. And someone who's vulnerable, who has particularly those who have pre-existing diseases, hypertension, diabetes, or even just sheer old age, and not to talk of serious problems like TB, tuberculosis, cancer, and HIV. Those ones are vulnerable because many of them are not in a position to respond as well as those who are very well. And those ones become the victim of the coronavirus.
Okay, it's talking about those category of people, the ones with the underlying health condition now. I want to find out, for those who got taken to isolation centers, what's the treatment protocol like? For instance, one with renal issues, with kidney problem that could be requiring dialysis. Then you have people with who have cancer, as underlying health condition. What's the treatment protocol for such people like when they are, they find themselves in their isolation centers? We are treating for COVID-19. Do you have experts in that field or those fields attending to such category of patients?
Yes, that's why we have divided the treatment categories into 4, actually. Okay. Category 1, that's level 1, is a holding area, generally, if someone has symptoms or maybe they just came from abroad, or particularly if they have been mingling with people who are positive and they have not yet been tested, but they are suspected. You place them in the category 1 facility where they must stay one in a room. And category 1 can be a hotel, and that is where we have put Nigerians who came from abroad, who are in a category 1 hotel where they are being observed for symptoms and they are tested. If they are negative, after 14 days, they go home. Okay. If they are positive, they go into a facility. Now, category 2 is a facility where you place patients who are positive. They have been tested positive, but they have little or no symptoms, and they require little or no treatment, actually. You just wait for their antibodies, for their bodies to develop enough antibodies to tackle the virus. And by the time they are negative, usually anything from 11 to 37 days, we have seen even longer than that. Once they test negative, they are no more shedding the virus, which means they have overcome the problem, then they go home. If they have cleared the virus. But then the category 3 are those who are positive, but then they have serious symptoms. And these symptoms can be breathing difficulty, severe cough, high fever, and so on. They require real treatment. They can have IV treatment. You can give them a variety of drugs which are being used for clinical trial that we are participating in now under the auspices of the World Health Organization. Now, the category 4 are the really critical ones who may require dialysis. Fortunately, we have not had many of them here in Nigeria. They require a ventilator, they require multi-parameter monitors, and they need to be in intensive care centers in ICU. So that's the category 4. Those are generally people who not only are positive, but they have underlying diseases that threaten their lives and need a very special and specialized attention with specialized doctors. Okay,
we're right now dealing with inadequate space, talking about isolation centers now, to the extent that I think like Lagos is being said they could initiate treatment from home, any moment from now. On that basis, I want to find out what sort of synergy do you have with the private facilities, I know they need to meet certain criteria, but how much of them have you been able to absorb in that treatment regimen where private hospitals can take in COVID-19 patients?
Yes, the Ministry of Health, the Federal Ministry of Health has developed guidelines for accreditation. That means that we have nothing against any private hospital who wants to handle COVID-19 patients. But again, let me remind you, this is such an infectious and contagious disease that you don't play with it, and you must have a facility that is ready. We recommend that the facility be dedicated just to COVID-19, or at least a wing of it, so that you do not run the risk of having other patients who came for something else get infected. Secondly, we insist that those who work there, both the doctors and the nurses, must have been well trained in the protocols for infection prevention and hygiene, because if you do not know those protocols, you are at risk of being infected. And we have had a problem of health workers getting infected and causing great embarrassment to the system, not only in the sense that they shouldn't have been infected, but in the sense that those who are infected are ill, have to go for treatment. Those who are not sure whether they're infected or who have no symptoms have to stay home for at least 14 days. And all these staff staying away from work for that long reduce the number of available hands when we need them most. So if you haven't had that training, you do not operate a COVID-19 treatment center in your hospital, in your private hospital. Now, there are hospitals that Lagos State accreditation team has accredited to handle COVID-19, private hospitals, and who are doing it because they have met the criteria which were established by the Lagos State government team.
Okay, I want to take you up on the issue of primary health care now. I know that, would you say that that component had been carried along adequately? I mean, especially now that we're in the community transmission, of COVID-19. If you've finally engaged primary health care now, what sort of engagement in terms of sensitizing the people, creating the needed awareness and health literacy?
Very good question. Now that we're in that transmission phase, I have brought out the primary health care and put them exactly at the forefront of response, because I remember I said that at the first stage, when it was a disease that was imported by people who had enough money to have been traveling abroad, and they came and their contacts, well, they were in a certain category. But now that you are at the community transmission phase and you can find coronavirus right down at the grassroots, that's where primary health care becomes extremely important. And they have been gearing up. We are insisting on activating a primary health care and the Department of Family Health inside the ministry for that purpose, to sensitize the public, the risk communication and community engagement, very important at this stage, and also to help in identifying cases, advising them to go for testing, or in fact referring them for testing and helping to isolate them or counsel them. In the case of Lagos State, they could even help to monitor those who they want to observe from home or from particular isolation centers. The National Primary Healthcare Development Agency, which is an agency under our ministry, has been very active now in developing models for response. For example, looking at converting school dormitories into isolation centers, they developed a very beautiful framework which we are studying, and to see if we can recommend it to Lagos, which already Lagos is at full capacity because they are the highest number of cases. So the primary health care, to answer your question, is now actively involved in this phase of community transmission.
Okay, while we look forward to getting out of the wood in no distant future, what's your take on these two states of Kogi and Cross River that are yet to confirm any case of COVID-19?
Well, yes, the Ministry of Health sent a team into Cross River State last week. The team went into Calabar. They were received by the governor. They've done the scoping. They met with the University Hospital there. They have also met with the Chief Medical Director. They spoke with primary healthcare. They had an exchange with the Commissioner of Health. They went to even see the traditional ruler. So we have engaged Cross River State now. So Cross River State is on board, and we hope that this new week we are going to be able to engage Kogi State in the same way so that we have all their data on board. So Cross River State will start giving us data, and they will join the platform of states that are reporting.
Okay.
If you have none to report, of course, there's none to report. You also say so. 0 is also a figure, and if you have something to report, you also report.
Yeah, because of the gaps we have in testing, there's a booming black market for rapid testing kits right now. People who just want to know what their status is, just go there and get tested. What's the implication of that?
Well, there's no implication if you do a test. It's just that that kind of rapid test, which is a serological test, tells you, yes, you have antibodies against COVID-19, which means you may have survived it. I told you just now that there are many people who have no symptoms. So those people will have built antibodies. Some people, in fact, who probably were never tested because...
So are you saying it's okay for people to go use search and get tested to ascertain their COVID-19 status?
Well, I'm not saying it's okay. I'm saying that whoever does it, you can't stop them from doing it. But it is not a reliable test for the medical sector, for the health sector, in that it does not tell you really who is actively carrying the virus at that very moment. So in order to... The test that you do is not to identify... The rapid test identifies the antibodies, which shows that, yes, you have been in contact. But the real test that identifies the DNA of the virus, that is the PCR test, polymerase chain reaction test, tells you, yes, we have found this virus in your system, and therefore you are positive. And by the time your system has finished clearing the virus, then you are negative. Now, that is the test that we rely on. That's the laboratory test.
Okay. As we look inward for local solution to COVID-19, how much support are our research institutes getting? For instance, I have this hand sanitizer that you remember NIPRID launched at one of the briefings. How much support had gone there? Because we had expected to see it being mass produced for Nigerians at this point in time.
Yes, a number of Nigerian entities are producing sanitizers. I don't think we are importing
immune
sanitizers right now.
I know they have some immune boosting formulations waiting to be tapped into.
Yes.
Is NIPRID and other research institutes getting the needed support?
Yes, they are getting the support as is available, because right now you are looking at the very acute problems, and the acute problem is how do I take care of those who are sick, and how do I take care of those who are at risk. How do I save their lives? So that is very, very... How do we get PPE? How do we make sure that our healthcare workers who are at the forefront are protected, that they themselves don't become victims? Those are the things that concern us most immediately. Of course, research is always there, and we have been telling our research organs, please go ahead, do the preparation for it, and some have got donor funds, and those who haven't got donor funds should wait for donor funds or for funds allocation from the sources. But the first things first, and we are trying to... I mean, we are happy that people in this country are producing sanitizers, PPEs and masks, so it saves us importation, and that saves foreign exchange, makes more money available. But let me use the opportunity also to say that one must be careful about these sanitizers, because some of them are not up to standard. They must have minimum of 60%, preferably 70% of alcohol on the label. You see it on the label, and they should then also have a NAFDAC number that shows that NAFDAC has given a clean bill of correctness.
The frontliners out there talking about the men and women of the medical profession who are saving lives, especially at this critical period, the health workers.
Yes.
What's your What have you got to say to them?
Well, I'm telling them that they're working very hard. They are the ones who the country rely on, and the country relies on you, and they want you to keep doing the job, but take care of yourselves. Do not take risks. We know you are passionate about your job, but look after yourselves, look after your families, and do not be overconfident. But above all, know that we have not yet seen the end of this virus. We don't know how it is unfolding, and we are hoping that we do not get the kind of catastrophic figures that we have seen in Europe or in some countries across the Atlantic. We want to be able to at least control the outbreak in a way that doesn't cripple the health system.
Okay, thank you so much, Honorable Minister of Health, Dr. Osage Hanire, for coming on Health Options.
Thank you, Rabi. Thank you for inviting me.
Just take responsibility. Stay healthy, stay safe, and curb the spread of the virus. Take responsibility. The coronavirus spreads from one person to another. Let us avoid crowd gathering of any kind for any reason. Take responsibility. Avoid traveling from one state to another during these lockdown restrictions. Obey all the rules that are put in place. Take responsibility. Stop spreading fake news and unverified reports about the coronavirus. There is no known cure for COVID-19. Take responsibility. Observe all the measures that can help stop the spread of the virus. Together, we can do this, but only if we take responsibility. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television. The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Individuals and collective survival of COVID-19 entails understanding how the virus works and how to keep it at bay. So, make sure you understand and practice the hygiene and social etiquette of coronavirus, which revolves around hand washing with soap and water, or the use of hand sanitizers, social and physical distancing, and wearing of face masks. You can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdallah. Many thanks for watching. Bye for now.